Hello everyone, I'm on the bike with 2 bags because I was supposed to go on a short weekend break to Norway, but it's not happening because of COVID-19, and I figured I'd update you a little bit more on that. Hello everyone, my name is Naomi Gabriel and I am a 4th year medical student, and today I would like to make a video on the current situation with the coronavirus or COVID-19 from the perspective of a medical student. But before we continue, I would like to disclaim 3 things. Number 1, I'm not an expert on this topic, and I have links in the description below of trusted organizations that can give you the information that you're looking for. Number 2, this is solely the perspective of me as a medical student in the Netherlands. I'm not speaking for all medical students in my country or anywhere else. And number 3, this video will not be monetized for obvious reasons. So in this video, I'd like to cover the topics that you'll see pop up on the screen right now. You can just jump ahead to that subject that you're interested in. Okay, let's get started. So let's have a quick overview of what is happening right now in the Netherlands. Today it is March 14th, 2020 as I'm recording this video. And as of now, the official tested cases of coronavirus in the Netherlands is around 1,000 people. Now, of those 1,000 people, around 130 are admitted to hospital. They need extra care to battle the symptoms of the coronavirus. And unfortunately, 12 people have lost their lives due to this virus. And for the general public, the National Institute of Public Health has implemented a few measures that everyone has to take in order to mitigate the spread of this virus. So just like anywhere else, probably at this point, everyone with flu-like symptoms, if you have a high temperature, if you're coughing, if you're sneezing, if you have any sort of illness symptoms, you must stay at home for 14 days and self-quarantine. Now, employees are encouraged to work from home as much as possible in order to not come into contact with many people. And as of a few days ago, universities and colleges have stopped offering their lectures with groups of over 100 people. And I even believe that most universities and colleges at this point have moved their education to online education to avoid any students coming into contact with each other at the faculties. However, elementary schools are still encouraged to stay open, and the reason that our minister president has given is that he doesn't want that wide-scale disruption of parents who might be police officers, people from fire departments or medical health professionals to stay home in order to look after their children. And the National Health Institute states that kids are low risk when it comes to spreading and attracting the coronavirus. Now, lastly, and that happened today, flights from high-risk countries such as China, South Korea, Italy have been prohibited to enter the Netherlands. And lastly, the public has been asked to reevaluate their need to attend social gatherings such as birthdays, other social gatherings, again to reduce the risk of spreading the virus. Now I'd like to get into my specific situation because I am still a student, but I'm also a medical intern at the local hospital. So there is kind of a gray area between being a medical health professional and being a student. As a student, I am no longer allowed to go to the faculty for education. All education has been stopped until April 4th. So this week I actually had an exam which ended up being cancelled due to that. And next week I was supposed to start on the neurology department. Now there are some other students there already on the neurology department, and they are still allowed to work at the hospital to do their internships. However, most appointments that people had in the outpatient clinic at the hospital, their appointments have been canceled. And this is kind of where it becomes tricky because those patients are usually the patients that we get to see. And usually we get to do the consultation and the physical examination. So now that these patients kind of have been instructed to stay at home, it's become a bit tricky to think about what our role is at the hospital. Obviously, it's new for most doctors as well. Not every doctor has ever experienced something like this, maybe with the exceptions for epidemiologists and infection specialists. But this is new to everyone. So some hospitals in the Netherlands have decided to send their medical interns home. We are first-year medical interns, but you have second and third-year medical interns as well. And the third-year medical interns sometimes get to stay because they are, we call them semi-doctors. So they are almost doctors, and I can imagine that they might be able to work out with more things, help out with things. And this weekend, most hospitals are thinking about sending us first-year medical interns home or using us to triage patients, maybe pick up the phone for patients who have questions and help out any other way that we can. So personally for me, I'm not sure if on Monday I'll be starting my neurology rotation, but what I do know is that this is going to be a time in which I can learn a lot. Because even if I don't get to start my neurology rotation on Monday, I can still make myself very useful, because the Municipal Health Organization for Preventive Healthcare is being overloaded with questions from patients. They are sometimes the centers that have to do the COVID-19 tests, and they definitely need help, and that is probably a job that is perfect for us with some experience in hospital, working in hospitals, but not being able to do much without supervision. So if I don't end up starting my rotations on Monday, I'll probably sign up to do a job at the Municipal Health Office, and they basically need interns from all over the Netherlands. I guess we're all having to rethink how we are going to progress in our education, because it also means that we don't have education for at least a month, maybe longer. But we will be able to do these other jobs that will give us experience as well. So maybe they'll count that as education in hindsight, and we just get to progress without losing any time going from the first year to the second year, etc. Yeah, I think as a medical student at first, and still, I'm not gonna lie, I'm quite anxious about this whole situation, especially if you look at Italy and how they have progressed, and obviously China and South Korea before that. Yeah, you can look at this from multiple perspectives, and I guess in some ways I feel like our national government is not doing enough to keep people away from each other. If you look at countries around us, such as Sweden, Norway, Denmark, they've closed down their borders. They've stopped education for all ages, not just college and university. And I think looking at Italy at this point, it might be better to close down everything for a while, because we're already seeing some hospitals in the south of the Netherlands who have code red, meaning that they are overwhelmed and that their intensive care unit beds are starting to run out. That is a huge issue with this virus. Many people compare it to the flu, and in some ways they are very similar, but the issue here is that we only have limited capacity in the ICU. So if people, and especially elderly, if they start to become dependent on ICU care, that will leave no space for other people who normally need that. It can start to affect many other patients very, very quickly. So what we want to avoid is that the hospitals can no longer take any more patients, especially patients who need high critical care. And that is the risk that we are running here, and that's what we're seeing in Italy as well. Looking at the numbers now, it doesn't really look like this is being managed anytime soon. Tests are also scarce, so they're not testing everyone. So the number of people who have been infected, around 1,000 people at this point, is probably much, much higher. But all in all, it is a very interesting time. Of course, it is devastating for the families who are affected by the coronavirus or maybe have lost family members because of it. I hope that I can learn a lot as a future doctor and also be of some kind of help. And I'll probably make an update video when things start changing, especially on Monday when I know if I can start my internship or not. For now, I want to thank you for watching, and I'll see you in the next video. So something else that I forgot to tell you, what I actually started the video with, is that I was on my way to go to the airport to fly to Norway. Me and some friends had some plans to go cross-country skiing, and we were already looking at all of the news reports because things are starting to progress very quickly with countries shutting down their borders, not allowing tourists into their countries. So we kind of already saw it coming, but it is definitely a pity that we couldn't go to Norway. If you have any questions, by the way, leave them down below. I'll try to answer them as best as I can, and otherwise refer you to a source that can explain it way better than I can. All right, see ya.